Hi, my name is Dr. Megan. I am a family doctor and sports medicine physician in the East Kootenay. This video was created by a local team of orthopedic surgeons, family physicians, and physiotherapists to help you manage your osteoarthritis. The video is part of the SORT project. This video will also help people to consider what treatments they might want to discuss more with their healthcare team. I ask that all of my new patients watch this video so that we can make the most of our time together. Now let's get started. Osteoarthritis is a degenerative condition caused by wearing down of joint cartilage. Cartilage is like a pillow or padding inside your joint. Cartilage, just like a pillow, can get worn down over time, especially if we don't take preventative action. Without this cartilage or pillow, our joints can feel painful and difficult to move. Some people think of osteoarthritis as wear and tear, and it is more common as people get older. Reasons why people may develop osteoarthritis include genetics, overuse, and injuries. The main symptoms include pain, instability, and decreased daily function. There are options to slow down osteoarthritis and limit the impact on your daily life. I'm going to talk through these options. In order to get the most benefit, you really need to engage with the treatments, and it can take a few months to feel the benefit. It is also important to know that orthopedic surgeons will recommend the strategies in the video, and in some cases will ask you to complete a long-term trial before even seeing them for an appointment. The first thing we need to discuss is exercise and strengthening. This applies to everyone. Consider your first prescription to be exercise. Exercise is an important way to manage and improve your osteoarthritis symptoms. A common saying is motion is lotion. Think of exercise as adding oil to a squeaky or hard-to-move joint. Physiotherapists are exercise specialists and will help you to increase strength and stability. Physiotherapists design exercises specifically for you, and this is different than just being generally active or walking. These specifically designed exercises will build strength in all the muscles around your squeaky joint. Think of the muscles around the squeaky joint as reinforcements. You may have access to physiotherapy via health insurance, or in some cases, your family doctor can refer you to a health authority physiotherapist. There are even online and in-person options like the GLAD program, specifically designed for hip and knee osteoarthritis. It is so important to see a physiotherapist, and even one visit can help get you on the right track. Other beneficial activities include non-weight-bearing exercises like cycling, ellipticals, or swimming. Using our squeaky joint example, these exercises add lotion while the joint is under very little strain. Other types of reinforcements for a squeaky joint are options that take some of the weight or stress off the joint. This could be well-cushioned shoes or a walking aid like a cane or walking poles. For some joints, like the knee, you can also get a brace. To provide benefit, the brace needs to be sturdy and the right kind for your squeaky joint. There are different options for braces, from off-the-shelf to customized options. Again, a physiotherapist is a specialist for this. The second thing we need to discuss is healthy eating and weight management. This applies to everyone. Consider your second prescription to be a good diet. Weight contributes significantly to symptoms. Using our squeaky joint analogy, the amount of weight we place on a squeaky joint will make it harder to move and be more painful. Let's look at some numbers. With each step, 1.5 times your body weight is loaded on the joint. What does this mean? Well, take the average 65-year-old Canadian man who is 86 kilograms or 188 pounds. For each step, their knee manages around 280 pounds. This weight increases quickly with common activities, like walking upstairs or getting in and out of cars. For example, the same man would put 660 pounds on their knees for each downward stair. We are asking a lot of a joint already under pressure. Again, this is why options like pool exercises or biking take some of the weight off of these joints and are really helpful. It is very important to focus on appropriate weight management strategies, especially if someone is above their recommended weight range. We know it can be hard to lose weight, and changing eating habits takes time. We recommend a good anti-inflammatory diet that reduces processed foods. In general, start by picking whole foods. Whole foods normally have 5 or less ingredients and are as close to their natural form. Think cherries, not jelly beans, and chicken breast, not chicken nuggets. Your family doctor can provide more information and in some areas a referral to a dietitian. You can also call 811 to talk to a dietitian. Medications can be used in some situations, and you should ask your family doctor if these are right for you. Once we have tackled exercise and weight management, our treatment options become more complex. This is a good time to introduce a tool called a decision aid. Decision aids summarize different benefits and risks of treatment. They are conversation starters. Ours looks like a pyramid. This is because the base of the pyramid applies to everyone and is the foundation of good osteoarthritis management. As you go up the pyramid, the options, or levels, apply to fewer people and are more intense, with surgery at the top. We typically only recommend a person move up the pyramid if their symptoms worsen and they have really tried and exhausted the level they are currently on. Exercise and weight management are the best approach in slowing down osteoarthritis and reducing pain. A well-oiled joint is rarely in pain. Looking at our decision aid pyramid, you can see this is the foundation and is green because it has short and long-term benefits for pain and joint health with little risk. I am going to use our decision aid to talk about our next strategy, medication, and specifically how to manage pain. Acetaminophen is a very good first-line starting medication. You might know this as Tylenol. Typically, it has the least amount of side effects and risk. However, people with liver disease need to be careful as acetaminophen is filtered through the liver. Another good first line is an anti-inflammatory topical ointment, more commonly known as Voltaren. Because these are rubbed on the skin, it doesn't carry the same level of risk as anti-inflammatories you need to swallow. This pyramid level is green. The next type of oral pain medication is anti-inflammatories, such as ibuprofen and naproxen. You might know these as Advil or Aleve. These carry more risk than Tylenol, such as kidney injury, stomach ulcers, and risks to the heart. For this reason, patients need to be more careful with these medications and should consult their family doctor before starting. This pyramid level is yellow because this option carries some risk. The last type of oral medication is opioids. This includes things such as codeine and morphine. These are not recommended for osteoarthritis management because of the risks. Over time, opioids also provide less and less benefit and require larger and larger doses to get the same result. There are very limited cases where opioids should be considered and only for a very short time. Taking opioids long-term can make pain harder to manage after surgery as well. This pyramid level is red because we really need to stop and consider the benefit versus risk. To summarize, we can use acetaminophen, anti-inflammatories, or opioids to manage your osteoarthritis pain. Using these medications does not improve your joint, but it can help you start exercising. When pain starts to interfere with sleeping, walking, or is stopping you from doing normal activities, it is important that you speak with your family doctor. I am a sports medicine physician. My role in osteoarthritis care is generally related to administering injection therapy. This is the next level in our pyramid. You might have already spoken to your family doctor about a joint injection. I want to talk about the different kinds of injections available and who might be a great candidate for these injections. The first kind of injection is steroids. Steroids have a place in management because they can help make moving less painful and are an inexpensive option, but steroids carry some risk. So it is important that we only use this option when someone will get the most benefit. This could be to help a person start and keep moving, or if a person is likely to need a joint replacement anyways. The second kind of injection to consider is hyaluronic acid, also called viscosupplementation. The evidence on hyaluronic acid is mixed. We do not know exactly how much benefit it might provide. However, unlike steroids, hyaluronic acid does not speed up the wear and tear, but the cost of this medication is high. It is around $500 to $600 and may or may not be covered by insurance. Some people report a lot of benefit from this injection for up to 6 months, while others get no benefit at all. The main risk with this injection is that 1 in 5 people will get a mild increase in pain for a short time, and approximately 1 in 100 will get a significant pain flare that needs a prescription medication. The last kind of injection we're going to discuss is platelet-rich plasma, or PRP. This is where your own blood is taken and spun down to get the platelet-rich plasma to inject into the joint. The risk of this injection type is low, as you are putting back your own cells. However, it is expensive, and again the results are very mixed. Some people get significant improvement, while others notice nothing at all. It is also difficult to access in our area. Regardless of what injection you and your healthcare team choose, you will only get the most benefit if you are still engaged with the foundation of our pyramid: exercise and good weight management. The decision about whether to proceed with injections is not always clear. This is a conversation between you and your healthcare team. But I would like to give some examples that I see every day. For the first example, we will look at Colin. Colin is a 50-year-old male with mild osteoarthritis in his knee. Colin has not done any of our other treatment strategies we have discussed, like physiotherapy or bracing, and he is overweight. Colin is on the first level of the pyramid. I would focus on exercise therapy and check to see how Colin's pain is in case he needs Tylenol or Advil to help him start moving. I would generally not recommend any of the other pyramid levels until Colin has committed to physiotherapy for at least a few months and when we would have another follow-up appointment. Now, let's talk about Helen. Helen is 61 years old with severe osteoarthritis. Helen is waiting for a hip replacement. She's at the top of the pyramid: surgery. Helen's pain is quite severe, and she is using daily Tylenol and Advil, but she can't enjoy gardening and doesn't join her walking club anymore. In this case, I think a steroid injection is reasonable, given that we already know the joint is going to be replaced and she would get short-term benefits. Helen is also exposed to the daily risks from her pain medications at this point, and a steroid injection could help Helen exercise with less pain so she is stronger and healthier before surgery. Colin and Helen are just examples, and you might be more similar to Helen or to Colin, or neither. It is important to think of your own risks and benefits and where on the pyramid you are. Before we look at what exercises you might benefit from, I want to ask one of our local orthopedic surgeons, Dr. Kate Vale, to talk about how these strategies might help you.
Hi, I'm Dr. Kate Vale, and I'm a local orthopedic surgeon specializing in hip and knee replacements, also known as arthroplasty. I am normally involved once patients have reached the top level of the pyramid and are considering surgery. Orthopedic surgeons are one part of the team specializing in joint health, and this video has introduced you to other team members at different levels of the pyramid, such as physiotherapists and sports medicine physicians. When surgeons receive new referrals, we always look at what non-operative treatments or pyramid levels a person has tried first. These treatments can reduce the need for surgery, delay surgery, or reduce your pain while you wait for surgery. Wait times to see an orthopedic surgeon are significant. It can be very frustrating for patients to come to their consultation after waiting so long with their mind set on surgery, only to hear that they need to go back and try non-operative options first. In most cases, patients do not start their osteoarthritis treatment journey at the very top of the pyramid. Although the majority of joint replacement surgeries go well, no surgery is perfect, and not everybody is happy with their result. Suggested activity restrictions afterward make surgery less ideal for people who do heavy labor, long-distance running, or other high-impact activities. As with any surgery, it is not reversible and there are significant risks associated. Therefore, we start with the less invasive treatment options, which is everything below surgery in our pyramid. Although some patients feel reluctant to take pain medication or try injections, the risks are generally much lower than surgery. These interventions can improve pain to allow patients to get moving and participate in exercise programs. Keep in mind that these exercise programs are specifically designed to help the joints move properly and are not the same as simply being an active and fit person. If you arrive at the top of the pyramid and are ready for surgery, hip and knee replacements are great at relieving pain coming from the joint. However, whether or not you have surgery, physiotherapy and home exercises are often recommended for the treatment of other symptoms such as weakness, instability, and other pain related to the soft tissues around the joint. Weight management and specialized home exercise programs can also help postoperative recovery and help you get the best result from surgery. Like Dr. Ewer said, a decision aid or pyramid is a conversation starter. We have great tools to help manage arthritis symptoms. Patients who engage and commit, starting at the foundational levels, set themselves up for success. Each patient's journey is unique, and it is important that informed decisions are made in consultation with your healthcare team.
I would like every person watching this video to start with the first level of the pyramid, strengthening exercises. For some types of osteoarthritis, I have asked the therapy team at Kootenai Therapy Center to demonstrate exercises I ask every patient to start. We want you to push yourself to become stronger and also be able to do the activities that you enjoy. If these exercises give you significant pain the next day, you may have overdone it. However, some pain during these exercises is okay or even necessary, as long as it subsides within a couple hours. The goal is to build up your strength and keep it. Please follow the next section or video. Thank you for following along with this video, and I hope this information has helped you.